Thanks, Tim. You heard David speaking this morning about one of the gaps at the moment is the patient-reported outcomes being incorporated into the extensive amount of data that's being collected. And what I'm going to talk about today is the project that's helping to fill part of that gap. It's a collaborative project between South West Sydney Local Health District and Illawarra Shoalhaven Local Health District and the Cancer Institute New South Wales. So Prompt Care is the first Australian integrated eHealth platform which uses systematically collected patient-reported outcomes to inform real-time survivors' care as well as self-management. So essentially, and it's funded by the Cancer Institute New South Wales and Bupa Health Foundation. Essentially, we collect patient-reported outcomes from patients. They're integrated in real time into the Oncology Information System, which in our case is Mosaic. Which I understand is not a great one from the talk this morning, but anyway, it's what we've got. And then that information is then used by the oncology clinical staff, where we provide them with feedback reports, both daily reports of that particular assessment as well as longitudinal reports. They're available to them in Mosaic as well as any other information about that patient. So that's available in real time. As well, based on the patient's self-report, we actually send out emails to patients with self-management links that give them information about the issues that they needed help with, where issues were above a particular threshold. The patient-reported outcome measures, of course, the first decision is what do you use? For this particular phase of our work, we decided on symptoms, distress and unmet needs. So we're using the Edmonton Symptom Assessment Scale, the Distress Thermometer and Checklist, and the Supportive Care Needs Survey. So there are 67 items altogether. Patients at this stage complete the assessments monthly, or approximately monthly, and that's ongoing from the start of treatment forevermore. So it gives us information about long-term effects as well as for patients that are on treatment. We send them an email link which they can complete the assessment from home. We found that to be far more acceptable than giving them tablets in the clinic in terms of flow through and not having to sit in the clinic for longer. Very high levels of acceptability by patients, and patients found the assessments, which took about 15 minutes at a maximum, as easy or easier to complete than paper copies, and they were willing to answer more questions. Clinicians also found it to be highly acceptable and commented that the information gave them greater granularity about what the issues of concern were for the patient. We're at the moment in the implementation phase. We've had more than 300 patients go through the system to date in 4 cancer centres, which, as you can see there, gives us quite a lot of items that we can go back and look to and think, how do we use those items efficiently for research purposes as well as identifying gaps in care, etc. We also have patients' permission to access their Medicare and PBS records, so we will be getting that information as well at the end of this phase of work. So how does all this contribute to improved patient care? The system level benefits of the system that we've developed here, the Prompt Care system, is that the patient-reported outcomes are integrated into the hospital's EMR, along with all the other information about the patient's care. We have systematic data collection, so it's not just people on trials. We have data about all of the patients, or we will have when it's set up, to be routine care. And we also have longitudinal data on those patients. Patient-centred clinical care is systematised to a greater degree, with reports accessible in real time to all of the care team who are involved in the care of that patient. We're working to promote self-management as well as shared care by GPs. In future, for us, particularly in South West Sydney LHD, we will need to be looking at how we make this accessible to non-English speaking patients. And there is also lots of interest to consider this for other chronic diseases. Thank you.